This is Liz.
This is Jade.
And this is Carly. And you're listening to
Babes and Babies. Yay.
Welcome.
Welcome back, guys.
We have some awesome stuff for you today. It is Endometriosis Awareness Month. So we have a doctor coming on to talk to you, and we have somebody who's gone through the journey to come on and talk to us, and we'll get to that a little bit later. But I want to hear from Jade and Carly. What's new in mom life?
Oh, gosh.
Jade.
Every day is a new day. Every day is a new adventure, right?
Jade and I had long nights last night, both of us.
Yeah. Oh my gosh. I didn't get any sleep either. Carly's like, I got no sleep. I was like, oh, me neither.
I'm glad we're in the same boat. We can be delusional together.
I know, gosh. And I haven't, like I told you, it gets better, but, so I'm like, hang in there. It gets better. But last night was just one of those unlucky nights where either I ate something she didn't like or it's something with her teething, but the girl was up, I swear, every 45 minutes.
Gosh.
That was a long night.
Bella likes to wake up at least once a night, and then she wants to stay up for like 2 or 2.5 hours just to like hang out with me. And she's so cute, so I can't be mad at her.
Yeah.
But I'm like, this is nighttime. You must go to sleep. And like, you can't just, and then I don't look at my clock. Like I look at my clock right when she wakes up, and then I look at it later and I'm like, how did 2.5 hours just pass? Like, I don't know where that time goes. It's very odd. The nighttime with your child, time like flies by. It's like
like a Twilight
reality.
Yeah, Twilight Zone. It really is.
Jade, I couldn't get over that picture you posted with Emmy with the crown hat on.
My gosh.
Oh,
I love the crown hat one.
The where the wild things are. Yeah.
Yes, that was so cute.
Oh,
and that one you just posted of her 7-month photo with the cutest little romper, like off the shoulder. That's the cutest outfit I've ever seen.
Isn't it cute? Oh, well, so it's not actually supposed to be off the shoulder, but she kind of has a higher, like, so I have like a short kind of chest, and so does she, like a higher chest, I guess. She must have that's weird to say, but she must have like my frame because it would just like kept falling off the shoulders and I couldn't keep it on, but then it ended up being super cute. So.
She's like, Mom, I know how to style this.
I know, she's already a little fashionista.
I love it. It is so cute. I can't handle it.
And then I love the picture, Carly, you did with Huck and Bella. How's Huck doing with Bella?
He loves her. Like the other day I was like, give Bella kisses, and he actually did, which I think is adorable. But
so
he just wants the same amount of attention I'm giving her. So now he like, if I have her in my lap, he wants to be right either in my lap or right next to my side. Like, so I'm petting him while like feeding or holding her. So it's like a lot of things happening, but he's still like, he's so sweet with her, which is great. Because that could have gone totally different.
Yeah, no, for sure.
Yeah, he just needs attention.
Aw.
He always has.
Don't we all?
Yes,
don't we
do.
all?
So does Evan. Evan also needs some attention. Last night I finally was like, Evan, we never cuddle anymore. Can we please cuddle? And so he comes, he gets home, and like we get in bed, and he comes over. He opens his arms so wide. He's so excited to cuddle. She's finally asleep. And he leans over. He cuddles me. The man fell asleep within 5 minutes. And then Bella woke up 5 minutes after that, and I was like, man, it was so funny.
That's real stuff, though.
It was fantastic, actually. I mean, we hadn't cuddled in so long. I can't remember, you guys, the last time we actually cuddled. That's really sad. It's probably been, like 8 months.
Really?
Oh my gosh, that is sad.
Well, just because like during my pregnancy, I was not feeling it. It's like, get off me. And now I'm like,
not even cuddling?
Feel it. No. I was so sick the first trimester, so definitely not, because if anyone touched me, I'd be like, I'm going to throw up on you. And then the bigger I got and the more uncomfortable I got, I was like, I'm hot. I don't know. I wasn't a nice pregnant person.
I was on fire during my whole pregnancy. I was so hot. I don't know. Something about my internal temperature.
Ugh.
Yeah. I didn't even sleep with comforters on. But,
Yeah. Like get everything off me.
No, totally. So speaking of cuddling and stuff, are you guys, like, I guess you're not up to the 6-week mark yet, but are you guys, how are you feeling?
I have a week and a half left.
How are you feeling about that mentally, physically?
So, you know, it's so weird. I really do feel like I'm healing down there. I finally stopped bleeding. Like, I could use a totally light pad and be fine.
Oh, good.
But I haven't felt like doing it. Like I said, it's my whole pregnancy. And now I finally feel like I'm getting that urge back to like be intimate. And I know it's going to hurt. So I'm like scared of that. But I'm excited that I finally feel like, hey, let's mess around, man. You know, but I haven't told him that because then I know, like, at my 6-week appointment, like, whatever's going on down there, if it's like not ready, then he's going to be so excited, and then I'm going to disappoint him. So I'm like, okay, so maybe when the doctor gives the A-OK, I'll be like, by the way, for the last month and a half, I've really been thinking about it. So yeah. I'm excited. I'm excited that I finally feel like doing it. And he'll be so excited when he knows I finally feel like doing it.
No, that is good.
What about you, Jade?
No, I actually feel the same way. I have not felt that way. I'm 7 months postpartum now. But I'm finally starting to feel like connected to myself again. And that makes me feel like ready to like be sexual, you know, and be like, and embrace my sexuality again. I'm kind of like on this whole, it's funny because last week we talked about anxiety and I feel like just talking about it changed a lot of my mentality this week. Just getting that all off my chest, I think, and having people to listen to me and just like tell me like, hey, it's normal. Like you got this. It's cool. And I'm on this like mama's got to get her groove back type of thing.
Yeah. Go Stella.
Yeah. And that's in like a lot of different aspects of my life too. Like I'm ready to kind of physically get my body back and kind of like try to feel sexy again. But that also has to do with like, you know, being intimate with my husband. So I'm excited to kind of explore that too. I feel like I'm feeling a lot different about it.
That's awesome.
Yeah. It takes time, so.
Yeah.
So let's stop for a hot minute so I can remind you guys about one of our favorite partners, KY. As some of you guys know, after you have children, your sex life changes, both physically and mentally. You're so busy, tired, stressed, and often we forget to make time for our partners.
But as we talk a lot about on the show, sex is obviously very important for maintaining intimacy and a healthy relationship. In fact, according to a recent KY survey of 1,000 U.S. adults in a committed relationship conducted by Wakefield Research, 97% of people say that having good sex makes them feel more connected to their partner.
This is something Tanner and I are now really prioritizing in order to work on having another baby. And because it's so important for our relationship. One of the things we do to amp up our alone time is to use KY, Yours and Mine, couples lubricant. I know that the lube is one of those taboo subjects, but according to the same survey, 92% of people say, and I can attest, it makes sex better. It's totally a no-brainer. I like this one because there's one bottle for me and one bottle for Tanner, which creates different sensations for each of us. It's a great way to spice things up and make our alone time easy and comfortable. Go to ky.com for more info. Okay, let's get back to the show.
So Jade and I are doing a photo shoot with our girls when she comes next week. And
that's so cute.
And I got us like sort of matching outfits and I tried mine on yesterday and it looks so bad.
It's so ended up,
yeah. Because I still obviously have like a little bit of a belly. And
so do I.
My hips are not like they're not like they used to be. So I was like, okay, if I wore something under this, it could probably work, like shapewear. But I was like, why? You know, I was like, I'll just get something more flowy. But it was one of those moments where I looked in the mirror and I was like, okay, you know what, Carly? You're doing really good for a month out of having a baby to be
right.
Oh, no,
looking
you look
this good.
You look fantastic.
And so don't put yourself down. Just get a little bit different of outfit. And then one day you could wear this outfit. Like, but it was kind of, you know, one of those moments where I was like, oh yeah, my body is different. Like you can't just get the tight dress anymore and expect to look the way that you did.
True. But dude, I am all about that Spanx life. I am not about
it. I don't
like,
have any. I need to get some.
They're lifesavers because those little back like muffin or love handles.
Yes, that's what I got.
It just like it sucks them right in. It makes your butt look so like there's no lumps. I mean, it's great.
Maybe I'll try that, the shapewear before I send it back. Because it really is a cute dress. It just, there's too much poking out right now.
Yeah.
My thing with like Spanx and stuff though, I feel like they need to create like a snap pocket to like pee or like a zipper. They're like such a hassle, and I pee a lot. I feel like it's so hard to get up and down.
I've had some where it kind of like it crosses over at the bottom that you can kind of pull it apart, kind of like male underwear. You know, they have the little hidden pocket that lets their dong. Like, I don't know what to say right now.
Like crotchless panties.
Well, except
yes, crotchless Spanx.
Kind of, except it folds over. So then you just kind of like open it. Yeah. I don't know.
Smart.
I'm talking. I don't know. It's weird talking about Spanx like this now.
I don't think it is. I think a lot of us are going to go buy Spanx now.
Yeah, exactly.
That's what I think.
Okay, guys, let's take a minute to talk about my new favorite shopping site, ModCloth. Their clothing is so cute and affordable, and they are size inclusive. So no matter what size you are, they have adorable items for you.
What's really cool is they now have a ModCloth bridal boutique, and it's perfect for wedding season, whether you're the bride, a bridesmaid, or you just want to be the very best dressed guest. You know you want to look good in those Insta pics. And like Liz said, you'll be able to find the perfect fit range from XXS to 4X.
I love how the ModCloth website is so easy to navigate too, and styling ideas from the What We're Loving section and following the hashtag ModCloth Squad on Instagram. With the different collections, amazing styles, and sales, it's 100% an awesome shopping experience. I have my eyes on all these new dresses that I plan to wear, especially to weddings this summer. You guys really have to go check it out.
For 15% off your purchase of $100 or more, go to modcloth.com and enter BABES. Hurry, this offer expires on April 21st. Again, 15% off your purchase of $100 or more. Go to modcloth.com, enter code BABES at checkout. Hurry, this offer expires on April 21st.
Okay, let's get back to the show.
Okay.
Well, thanks for updating us. Are you guys ready to dive into getting some knowledge on endometriosis?
Yeah,
Let's
so
do it.
So I feel like I didn't know it was Endometriosis Awareness Month for March until you told us, Liz. And just putting some stuff out on my Instagram, I realized it affects so many women, and it's very unique for each woman, but I didn't realize how painful it is and how long you can have it and all these things that I'm really excited to talk about because I want to support, my fellow woman, and I didn't even really know a lot about it. And it's crazy that I guess it has a lot to do with infertility and all those things. So we're bringing on a gynecologist who's awesome, who's going to talk to us. And then I think you said, Liz, another female who she actually has a child. I think she has one child, and she has endometriosis, and she's on to advocate for the disease and women who have it. So, should we get our doctor on the podcast?
Yeah,
Yes.
Let's bring her on.
Okay.
All right, so we have Danielle, who's an OB-GYN, and we're going to go ahead and have her introduce herself and dive into some endometriosis talk.
Hey guys, thanks for having me today.
Hey.
My name is Danielle Jones, and I'm an OB-GYN practicing currently in Texas. I am excited you guys are talking about endometriosis today, and this is such a great month to talk about it, and I'm ready to see if I can field some of your questions.
Yeah, for sure. So I guess I just want to know for you, like as a medical professional, why is endometriosis awareness important to you?
Well, I think what a lot of people don't realize is just how incredibly common endometriosis is. So up to about 5% of women who have no symptoms are affected by endometriosis, but 20% of women who have pelvic pain and up to maybe 50% of women with infertility have this disease. It has a lot of broader implications and can be problematic and is difficult to diagnose and treat. So the more people are aware of the symptoms and how to bring it up with their physician, the more likely they are to get the appropriate diagnosis and treatment.
For our listeners who don't know what it is, can you tell us just kind of what endometriosis is and just a little bit about the disease?
Yeah, so endometriosis is basically the cells that are on the inside of the uterus somehow find their way out into other places in the body. The most common place is the pelvis or the ovary or the fallopian tubes, but there's case studies of endometriosis being in crazy places like the lung and brain. So we don't understand. Yeah, it's really interesting. We don't understand exactly how it happens. There's a lot of theories as to how it happens, but it needs more research, which is another reason that awareness is so important.
So one of the things that I read, you can tell me if this is true or not, is that it actually can start in puberty, but sometimes it doesn't even show symptoms until like 10 years later. Is that true?
Yeah. So we have a lot of evidence that says potentially endometriosis is related to when you have a period. And this happens in everybody. We don't know why some people are affected by it and some people aren't. But when you have a period, some of that blood goes the other way out the fallopian tubes and into the pelvis, which allows those cells to kind of grow there. And so a lot of people think that potentially that starts at puberty, and maybe that those cells and the people who for some reason are harboring those cells in their pelvis, they start having it happen then, and they may not have any signs or symptoms for many years. Some people never have symptoms. I mean, I've done hysterectomies on people who really never had any problems with pain and then ended up having endometriosis on their pathology. They had a hysterectomy for another reason, and it just showed up when the pathologist looked at it.
That's crazy.
What are the different, symptoms of it?
The most common way when I see somebody in my clinic that they'll present is with pelvic pain. And the most common pelvic pain is going to be pain with sex or pain with periods. But there's a lot of other things that can cause that, which is why the diagnosis can be so difficult. Infertility or subfertility is probably one of the second most common ways that people will present. And probably the most common way for people to be diagnosed is when they're having difficulty getting pregnant. There's also a tendency to get an ovarian cyst called an endometrioma. And so sometimes we will see somebody who's just been having pelvic pain, and we do an ultrasound and they have a cyst on their ovary, and it has a real classic appearance on the ultrasound, and then you can diagnose it that way as well.
Wow. I'm curious how, since it is so hard to diagnose, and so what are the ways, that it is diagnosed? Like, do you normally just do an ultrasound to discover it, or is there other ways that you would know that somebody has it?
I know some people said that it's surgery. They didn't know until surgery. Is that correct?
Yeah. So the traditional teaching and gold standard for this is that diagnosis requires surgery. So we'd do a minimally invasive gynecologic surgery and take a biopsy, essentially send it to the pathologist, and they look at it under the microscope. So that is how you technically diagnose this. Although I and most practitioners have a tendency to make a clinical diagnosis based on somebody's symptoms, just because there's a lot of risk that surgery entails, and that should probably not be our first go-to when we can try treatment first and see if that improves anything. You can sometimes see it on ultrasound, but it's very difficult, and somebody has to have pretty significant endometriosis to have any findings on ultrasound other than the cyst. If that's there, it's pretty easy to see.
That's crazy. So when I searched a bunch of stuff on Instagram, like hashtags for endometriosis, there were women making jokes about their belly bloat. Is that something that happens? Because some of these bellies were they look like they were 4 or 5 months pregnant.
Yeah, I could see some situations where somebody could have bloating associated with endometriosis, although it's not a symptom that we consider kind of a classic textbook finding.
Okay.
The cells kind of get into the pelvis. They make inflammatory mediators, which is just anything that can cause inflammation, and that could probably relate to it.
Okay.
What, you said after you kind of diagnose this, you can start some treatment. What's the treatment look like for endometriosis?
Treatment can be difficult, which is probably why you will find a lot of very frustrated women on the internet talking about being either misdiagnosed or mistreated or felt like somebody didn't listen to them. And it's because you have to find somebody who has a specific interest in this to go see. I really encourage my endo patients to make frequent appointments and not disappear, because the tendency is sometimes that treatment didn't work for me, I'm just not going back. And this is often something where we have to try multiple different treatments before we find the one that's individualized to each patient. So that can be, there's a lot of ways to treat it, but when I see someone in clinic, your goal is what helps me guide your treatment. So sometimes women come in with infertility and their goal is to get pregnant. One of the mainstay treatments of endometriosis is being on birth control pills. Obviously, I'm not going to put someone whose goal is pregnancy on birth control pills to treat their endometriosis. So we need to talk about other treatments. Because it's an inflammatory process, being on anti-inflammatory medicines like prescription strength Motrin, things like that, on a particular schedule that we have to define by each person, is often very helpful. If the patient's not trying to get pregnant, then the first stop is birth control pills in a continuous fashion. We're not having periods every month, and that paired with an anti-inflammatory medication. There's a lot of other options past that. Progesterones, Nexplanon, which is the implant that goes in the arm, IUDs, medicine called aromatase inhibitors, GnRH medicines, and then surgery can also treat it. And surgery is a good treatment for somebody who is trying to get pregnant, because we do the surgery and essentially remove the endometriosis. There's a bunch of different ways to do that, and it increases fertility and decreases symptoms. The downside of surgery is that it comes back eventually, and so it's not a definitive management.
Gotcha.
Let's just stop for a minute so we can talk about one of my favorite subjects, wine. Bright Cellars is the monthly wine club that matches you with a wine that you'll love. Whenever I'm picking out wine to buy, I'm like never sure which one I'm going to like. It really makes a difference to get wines that are specifically chosen for you. All you have to do is take a fun little simple quiz where they will ask you questions about your palate, like what types of chocolate do you like, or how do you take your tea? And their algorithm will recommend the top 4 wines around the world that you're most likely to enjoy and love.
Yes, you can write your wine matches down for later or get them sent straight to your door. And because they're our sponsor, we have a special discount for you on your first wine shipment. Go to brightsellers.com/babes to see your wine matches and for 50% off your first wine order. That's bright like a light bulb, cellar like a wine cellar.com/babes for 50% off your wine matches. brightsellers.com/babes. Okay, what's next? So looking up endometriosis this month and talking about it has made me question if I have it, and now I'm freaked out a little bit. I don't think I do, but about 4 years ago, I was experiencing tons of pain in my ovaries. It would be super random, but more when I'd work out or different things, and then I would spot, and then I'd get diarrhea, which is super weird. But then I would spot a lot, and then recently, these girls know I was talking about it before, how this last month I just had the period from hell, tons of clots. And then since then I haven't really stopped spotting. And I've never tried to get pregnant, so I don't know if I have any problems, but my periods are super regular and things like that. So when would be a time, I guess, that somebody would be I have a gyno appointment this week. I went last week. They did blood work and some other things just to make sure I'm not anemic and ruling out other things, doing an ultrasound. But when would somebody be okay, is this normal or is this not normal? Does it affect your hormones at all too?
It does affect the hormones, I guess, to an extent, because it's an estrogen dependent process, and those cells actually have some variations in how they function that can allow them to be more sensitive to estrogen. As far as this is what makes the diagnosis so difficult, is that it can overlap with so many other other things that women are experiencing. And then I think anytime somebody's periods change, they should just make an appointment with their gynecologist and go in and talk to them. And you mentioned worrying about infertility, and I see that a lot in my patients. I live in a college town, and so I have a lot of women who are professionals and professors and have delayed childbearing. Sorry about that. They will come in and be worried about fertility. And I try to encourage them, don't worry about fertility until we're ready to start trying, unless you're over the age of 30, 35 and still thinking you're going to delay it for several more years. If your periods are regular, probably that is not an emergency call. That's the best indicator. It's always worth a conversation with your doctor.
Yeah. Right. I mean, I know, like, I had someone tell me a while ago that it might be hard for me to get pregnant. And then I got, we obviously weren't trying, but then I got pregnant. So I think, yeah, it's definitely important before you, if you do have symptoms or if you do have endometriosis, like, to not think I can't get pregnant, like, to try first and then see, because I mean, that's not always the case.
Yeah, absolutely. And actually, I see both sides of this. I see women who come in with an unexpected pregnancy and say, I had a doctor tell me I could never get pregnant. And I never, ever tell people that, because then their tendency is to think, well, I can't ever get pregnant. I don't need birth control. And that's not a good way to practice either. So,
right. Yeah, that's actually, that's what happened to me and Evan, because I was like, I had just gotten off an IUD and I said, well, I had a doctor tell me that it would take a while. I had frozen my eggs and then I was like, so we have a backup plan, and then I got pregnant and he was like, I thought you said, and I'm like, oh yeah, well, that wasn't a correct diagnosis.
Here we go.
Right. But yeah.
So you were just recently married and got pregnant soon after?
Well, I got pregnant like 2 weeks before my wedding and didn't know until 2 days after my wedding. But hey, it's around the same time.
Well, no, yeah, either way, but that's overwhelming. I can't, as the mom to 3 and navigating being newlyweds and having a baby, like, props to you. That is, good job.
Yeah, it's been quite the year, but I always want to say to people who, who do think that fertility could be an issue, to not be so scared at first, because there are so many women that go into something, they're like, oh, well, I have this or I have this. And they're like, so I probably can't get pregnant. And I'm telling you, that's all, that is definitely a fact for some things, but lots of the time too, it's be careful because that's not always the case.
Sound advice.
Yeah. Let's take a second to talk about the best way to listen to audiobooks. Audible. Audible is an incredible membership service that includes 1 free audiobook a month, exclusive sales, and 30% off regularly priced audiobooks, and lets you listen to your books from any of your devices, wherever you happen to be.
I absolutely love this service and the fact that I can listen to books when I'm at home with Bella or when I'm on the go. I started reading Women Who Run with the Wolves, which I chose because obviously Jade told me about it, and it's such a great book, and Audible lets me listen easily and just pick up where I left off. If you didn't like your audiobook, you can exchange it, no questions asked, which is such a great feature.
The books you choose in Audible are yours to keep and access whenever you want. And Audible members get a credit every month, good for an audiobook in their store. And Audible is offering our listeners a free audiobook with a 30-day trial membership. Just go to audible.com/babes and browse the unmatched selection of audio programs. Download a title free and start listening. It's that easy, you guys. Go to audible.com/babes or text babes, BABES, to 500-500 to get started today.
That's AUDIBLE.com/BABES or text BABES to 500-500 to get started. So Danielle, I think, or Dr. Jones.
Oh, please, Danielle is fine.
I think we just have a couple more questions for you. So we've talked a lot about like different treatments and things like that, but is there a cure for endometriosis?
There's not really a cure. We can do a good job of managing it if we can take the time and the effort to troubleshoot. And that requires a physician who's willing to do that and who knows enough about the topic to do that. And then also a patient who is, it can be extremely frustrating for a patient to have to go through multiple treatments before they get any improvement in their symptoms. So no cure, but it can be managed. And I just encourage women, find a physician that you trust and that you can continue to see. And the value, I'm always telling people the value of a quote talk only visit cannot be underestimated. I'll have people who come in and they're there for their annual and they need a pap smear and they need to talk about all of these other things. And I'll encourage them, come back, make a talk only visit where we don't have to do an exam and we don't have to worry about if you're up to date on your mammograms and all of that. And we can just sit down and talk about what's going on. And that cannot be underestimated for how important it is.
Yeah, Jade was saying that on the Endometriosis Foundation website, they do not recommend a hysterectomy as like a sound treatment, but yet so many people have gotten them. Like even when we said, hey, we're talking about endometriosis, who wants to share their stories? And like women after women were just saying how they got a hysterectomy. Why is it that they go that route?
Yeah, so a hysterectomy, usually with removal of the ovaries and the uterus, it is a treatment. It is important to delineate that as not being anywhere close to a first-line treatment. In my practice, I have a few categories that people have to fall into to consider that a treatment. And one of them is they have to be done with childbearing. So if you are not sure that you're done having babies, then that's definitely not a treatment. You also have to have tried medical management and that hasn't worked for you. And we also have to have a for sure diagnosis, especially if I'm going to take the ovaries out, which improves the chances that the surgery will fix the problem, but brings along with it a whole host of other problems, particularly in women who are younger than 40 or 50. So.
Mm-hmm. What advice would, I guess, like what's the best way for people who don't have it but know people who do? Like, what's the best way to support somebody who's dealing with this?
Yeah, that's a really excellent question. The endometriosis is kind of an invisible disease. So women can have just debilitating pelvic pain from this. And interestingly, even when I do surgery, the amount of visible endometriosis I see doesn't correlate to somebody's pain. So I can have women who have very little pain and just infertility, and their pelvis can be just a mess of endometriosis. And then I can have women who have debilitating pain where they're missing work and not able to do their day-to-day activities, and their surgery can just not look that impressive. So listening and believing the things that they're telling you is so important. And I think that's important for us as physicians also, because we're taught to look at somebody and use our physical exam skills to decide what we think is happening. And you can't see it. So I think just supporting them by being there and listening and understanding that they may be having problems even if they don't look like they're having problems.
Yeah, no, that's really good. I think that is kind of all of the questions that we have for you. Thank you so much for filling us in. I learned a lot.
I also did.
Yeah. Well, thank you guys for having me. I've enjoyed listening to your other recordings and talking about, I love infertility and kind of being on Instagram, as my Instagram is Mama Dr. Jones, which I kind of started just to. Interestingly, OB-GYN is a specialty where a lot of people are afraid to go into it because it's surgical. And women are afraid to choose a surgical field because they want to have a family. And, I have 3 kids, and I'm just trying to inspire, if you're a medical student and you want to go into OB-GYN, you can do it. And I don't know.
That's awesome. Where can people listening, I guess, find out more about you?
Yeah. So I have a blog that I've been keeping for in like an embarrassingly long time now, which is mindonmed.com. And I started that my first or second year of medical school.
That's awesome. You're like a blogger before blogging was super cool.
I know.
I was definitely writing before it was cool, and my classmates and professors didn't think it was cool.
They're like, why is this taking up so much of your time?
That is exact, yes. And then Mama Dr. Jones on Instagram is, I share kind of day-to-day sneak peeks into OB-GYN life when I'm on call, and stories and information for patients about common questions like, can I have coffee when I'm pregnant? And what do I do if I want birth control, but I don't want to take a pill, and things like that. So
that's awesome. Well, we're so thankful. This is so great. We so appreciate you, and you're on call, and you made the time for us, and that is so nice.
Yeah, absolutely. Well, if you ever have questions that I can answer, I'm happy to do that. And I'm so happy for your listeners that you're approaching this subject that is often under discussed and too quiet.
Yeah. Well, thank you so much for sharing with us. And we can't wait to have this out so everyone else can listen to it too.
Me too. Thank you, guys.
Yeah, thank
Bye.
you. Bye.
Okay, guys, so we have another guest on today's podcast, and she's talking all about endometriosis as well today. She's an advocate for it. I believe she actually deals with it. Welcome, Shelley.
Hi, everybody.
Hey.
Welcome.
So I guess what we really want you to talk about is just your journey with endometriosis. And I know you said you actually, how many children do you have?
I have 1. He's 4.
He's 4. So just your experience with, I guess if you had any infertility issues and anything, and just what you're passionate about when it comes to this disease in women.
So for me, I wasn't officially diagnosed until June of 2017. And I'd been dealing with, mystery pain since the October before, so about a year. Okay. And looking back at the timeline, it matches up to about when I stopped weaning and stopped breastfeeding. So for me, I had a C-section, and even though there's no known cause technically, they think maybe mine was from my C-section since I didn't have issues with infertility or debilitating symptoms before I was pregnant. It's kind of a mystery in that sort of it. But yeah, the pain really started for me in October of 2016. And it took being a medical guinea pig to finally get diagnosed through surgery where they sent a tissue sample to pathology.
Wow. What did that look like before they did the surgery? Like, I guess what was, like, how many times did you have to go to the doctor? How many different things did they try?
Oh, it was crazy. I felt like I spent the entire year of 2017 in and out of my primary care and then sent all over to specialists. But the biggest thing for me was the ER because it kept feeling like my appendix was rupturing, would be like the
gosh.
Yeah. So then I had my son and I'm a single mom. So he'd be like sleeping and one of them was in the middle of the night. And I'm like, okay, I just got to like wait it out till 7 when my neighbors are awake. I'll take him to school and I'll go to the ER. And they treated me like I was totally crazy. Like they did a CT scan. It was fine. They did ultrasounds. They found cysts, but they were, quote, normal. So then they said, there's a bunch of free fluid in your abdomen. So it must indicate a ruptured cyst. Basically, it's like internal bleeding, right? So then you get GI. Gosh. Yeah. So then you get GI upset. But the list, like the telltale list where you can really start to figure out, do I have endo or not? Is this more than just a bad period or maybe something else going on? There's sort of, about 10. So for me, it's my list was heavy periods that seemed never ending. They would last like 2 weeks with spotting.
Oh my gosh.
Oh my gosh.
Yeah.
You
So
poor
like
thing.
try being in like a normal relationship, you know?
Oh,
Good luck.
no.
I'm like, oh no, I really am still on my period. They're like, okay, bitch, you know? Yeah, sure. And then the ruptured cyst, obviously, or you can get the PCOS symptoms of basically multiple cysts on your ovary, but have your hormones test fine. So another symptom can be multiple ovarian cysts on either side. For me, I always have like a chronic, like nagging pain in my lower abdomen. So that's one a lot of people have. It can radiate sides, but a lot of people have it in their lower right side. Pain during and after sex is a big one if you have endo. GI issues, people say endo belly, you get so bloated. It can cause food intolerances. Obviously, you have bad gut health and anxiety and depression, ovulation pain, lower back pain. I mean, there's a list that goes on. And then obviously infertility is a big one too. I just don't have personal experience with that yet. I mean, maybe in the future, I'm not sure.
Yeah.
Wow.
Listening to the list, it freaks me out because then I feel like I have endometriosis.
Right. And it's crazy. It can be, a lot of those things are also autoimmune or, you know, IBS even. So it's hard. You truly have to be your own advocate. And the fact that endo doesn't show up on a CT scan or an MRI or an ultrasound, you know, you go through the ringer seeing all of those specialists bouncing back and forth. A lot of us had colonoscopies to see if it's GI related. So then when you finally get a good OB who's like, all right, we need to do surgery, then all you're left with is, oh, you have it. So it's like, well, now what?
But how like good did it feel to like actually have an answer to like what you were going through?
It was like a 50-50. I feel like at first I was like, wait, what is endo? Like, and then when I researched it, I was terrified. So there was that. And then the other part of me was like, I really wished it was just a ruptured appendix. Like, because even though you'd say, oh, well, it calmed my anxiety to have an answer, then you hear there's no real treatment, you know, besides excision. There's no cure. So it's kind of like a depressing diagnosis to deal with at first, for sure.
Yeah. What is it like emotionally? Because now that you have a diagnosis, but what is it like every day? Not only living with the physical pain, but like, I guess the emotional side of it as well.
I think it's super hard. I have days where I'm just like, this isn't fair. Where's my old body? Like, where's my old wanderlust life? I think the biggest thing that endo women have is that state of constant fear and panic, because you never know when your next flare is going to be or when your pain's going to come on. Like, some people only have it during their period. So at least that's somewhat manageable for travel or making plans. But for a lot of us that it's daily, it can cause a lot of anxiety because you never know, like, even just a brunch with friends, like, am I going to feel okay? Like, will I have the energy to take a shower and like want to go do that? So it can cause a lot of like fear, panic, anxiety, and depression because you miss your old life.
Right. Can you take anything to help the pain?
Unfortunately for me, there's been no magic like pain pill. I mean, I've had flares where I'm in the ER and they're like, okay, here's a Percocet and here's some tramadol and here's, what's the biggest one? Morphine. And it doesn't touch it. Like, it's not like, oh, I have a broken arm. Like, let me feel better. It's like inside, like your guts, you know?
Right. Yeah. And it's a constant, it's an always thing, not just a, hey, I broke my arm and it's going to be okay in a couple weeks.
Totally. And like one of the other biggest symptoms I forgot is the chronic fatigue and exhaustion you get, because a lot of times you can't sleep and your body's in a state of inflammation. So it can't really like calm down. So you're just tired so much. And as a mom, that's the worst part.
Oh, yeah.
Yeah. So it really does affect your day to day. Well, they said like for a lot of women though, like they've had it for a long time and maybe their symptoms weren't as severe as yours. So it took them a while to discover it. Whereas yours, it kind of sounds like everything kind of came on all at once.
Yeah. And then I try to look back and I'm like, okay, people say like growing up, they started their period early or they always had bad cramping and, you know, some sort of pain they couldn't figure out. And I'm like, well, maybe I had that. I was on the pill when I was like 15 because I was puking from cramps and needed to go play soccer and volleyball and get my shit together,
Right.
So it's like maybe, and I always had painful sex in college and was told, well, like some people just have that. Here's some lube,
Right.
So looking back, yeah, it's interesting. You wonder, like, does it start like that slowly? And then one day you have a ruptured cyst and it's like, boom, endo? I don't know.
Do you have any friends that you could like, that had it, that you could talk to about it or anything? I know sometimes it's like, oh my gosh, you have this too.
I didn't, but thank God for social media sometimes. I mean, it's a blessing and a curse, obviously,
Right.
but I was able to find like so many people just through talking about it openly on Instagram and my blog that was the first time I really felt like I'm not alone, because no one in my immediate group of friends had it. No one in my family. Like a lot of times people say, oh, it's genetic. Like your grandma probably had it. It's like nobody had it in my family. So,
wow.
Yeah.
What would you want to I guess, offer to women who are listening to this who might be going through it or think that they might have it, or, they're experiencing the same things you did and they haven't gotten answers yet? What's some either advice or comfort that you would want to offer them?
My first and foremost, is you are not alone and you are not crazy, because doctors will try to make you feel like this is in your head. Like these are, classic symptoms of anxiety. So here's an antidepressant. It's like, at the end of the day, you know your body and you know that something's right or something's not right. So don't give up. And, it's a bummer if you have HMOs for insurance, you need a referral, but ask for the referral, like make them give you the referral. If seeing a GI will give you peace of mind, like rule that out. Go to an OB until you find one who can relate to you and sympathize. Like I went to an OB who was like, well, it's real unfortunate you're divorced because the cure to endo is pregnancy. And it's like, no, it's not. So just don't give up, be your own advocate, and trust that you're not alone and there's other people going through this, and find them, even if it's online in a support group, but don't let that rule your life. You can't give up all the things you love because of an illness.
That is so important. Where can people find you, your Instagram and your blog?
My Instagram is Salty Sweet Seasons.
So cute. I love
that. Is so cute. I know.
I changed it. Like once I knew I had endo, I was like, that's like perfect. Like I had to change it to that. Obviously it's documenting the salty and sweet. And then my blog, they can find my website, saltysweetseasons.com or shelleyhopper.com.
Amazing.
Awesome. Is there any last bits that you want to leave the listeners?
I would just say that my heart goes out to you if you have endo or any other kind of chronic illness or autoimmune. Just don't give up. Listen to your body. Know when something's not right, and find support in those that can help you. And don't stop talking about it. It's so important. We're making a difference.
No, for sure. And that's why we're so glad that you were able to join us and share your personal journey with us, especially with it being Endometriosis Awareness Month, and just letting women know that, people are trying to make strides out there,
Exactly.
to give women a voice about it and help each other out. So thank you so much, Shelley, for coming on here.
Thank you, Shelley.
Thank you guys so much.
And we cannot wait to share your story with the listeners.
Yeah, you'll have to let me know.
We will.
Absolutely.
We will. Okay. Bye, guys.
Right, thank you. Bye.
Bye.
Well, I learned a lot.
Me too. Oh my gosh.
But now I'm actually really paranoid that I might have endometriosis, because my periods did change and I do have weird ovary pain and I've been spotting a lot, and I have an ultrasound actually on Tuesday, but they're like, you might not even see anything. So I'm like, great, I have it.
I guess that's just the crazy thing about it, is that it sounds like you have to have that little incision surgery to even have a diagnosis. So it's kind of scary, because you're like, yeah, I have pelvic pain. Yeah, I have weird periods and all that stuff. But it's like, to have a little surgery is pretty invasive. So it's kind of crazy that has to be the option in order for, say, if you were worried you had it, that's what you would have to do to actually get a confirmation.
Yeah, it's interesting because they call it the invisible disease.
Yeah.
Wow. Because it really is.
Yeah, and I had no idea until we started researching this that 1 in 10 women have it. That's just, it blows my mind.
No kidding.
Yeah, that's crazy.
Yeah.
That's absolutely crazy. See, I don't have pain though. I don't have painful periods, and I don't have like pelvic pain anymore. So
yeah,
maybe I don't.
Well, the good news is when this comes out, lots of people will be there to hold your hand if you do. And if you don't, then you don't.
Right, exactly. Well, and I just I know that we asked some questions in our Facebook group about it and on Instagram, and just thank you to everybody who shared their stories, and we're talking about it and just creating that discussion, because since it is the invisible disease and there is no exact cure, it's so important to be talking about it and letting women know it is a thing. And if you are experiencing these things, that, there's other people that have been there and you can ask for answers,
Mm-hmm.
Yeah, which reminds me, did you guys say that Dr. Jones, Danielle, that she's willing to answer questions in our Facebook group?
Oh, no, not yet.
Okay. Yeah. So Danielle texted me after she got off, and she said, if any of our listeners have any more questions for her, she was our OB-GYN that was on. She's willing to talk about it in the Facebook group. So I think that's really amazing that she is willing to reach out and help everyone. So
yeah, that is great.
Yeah, it's so nice.
I know. I really enjoyed talking to both of them, because I haven't really just had a conversation with anybody who's dealt with it or gone through it, which is crazy because it's 1 in 10. So I know somebody that I know. Well, I know Vito's cousin has it, but but growing up, not that I know of anybody did. So, but I know now somebody did,
Right.
But yeah, thank you guys so much for listening. We hope that this was informative to you. We hope that it brought you encouragement. And if there's any specific topics that you guys want us to really talk about, we love hearing your guys' feedback in our Facebook group, or message us. And don't forget to subscribe and download our podcast and share it with other people. We love hearing those things from you and hearing that you're listening and what you learned and shared with people.
Definitely.
So if you want to check us out outside of Babes and Babies, you can find me at eSandos.
And I'm at Jade Liz Roper.
And I am at Carly Wad. I'm never going to say that any different.
I know. All right, guys, thank you. Oh, go ahead.
I was going to say, I love it because I anticipate it every time.
I know, me too. I'm wait, is she going to do it?
Maybe next week I won't, just to trick you guys.
just to see. All right, guys. Well, thank you so much for listening, and we will talk to you next week.
Bye, guys.
This podcast is brought to you by Wave Podcast Network. Check out all of our shows, including the Brain Candy Podcast, I Don't Get It, Babes and Babies, Coffee Convos, and Let's Talk About It.